We are back with Dr. Stoller here at Atlantic Health Systems, home of Atlantic Sports Health, with talking about now concussion therapies. We've really talked a lot of different areas of concussion and diagnosing and whatnot. What are some ways to treat?
So after an athlete or a student has a concussion, we look at what are the ways we get them back in a restorative and rehabilitative process to themselves. So I always look at a student athlete as the first thing is how are their academics, because they're a student before they're an athlete.
Yep.
So we first institute academic modifications for their school. We pull them from gym class, we pull them from their regular sports so they don't have further injury. Then we engage them into what we call low-level exertion with physical therapy. We don't want to have the athletes sitting in a dark room with no exposure to anything. We want them moving. It's healthy for their development. It's healthy for their growth, but we don't want to overdo it. So if symptoms start after jogging for, say, 5 or 10 minutes, we pull back. And then the next day, maybe start it and see how things go. Once the athlete gets to a point where they're fully back to normal, we do what's called a graduated exercise protocol or return to play. And that's a stepwise progression of athletic activity to ensure that they're going to tolerate practice and then gameplay on the field.
Yep.
So that's physical therapy. When the athlete or patient goes for a longer period of time and they're still not back to normal, we look at vestibular or balance therapy to help them with dizziness and coordination. We look at cognitive therapy to help with memory and concentration. And then lastly, we look at something called occupational therapy for eye tracking. And that is in a subset of patients who, for one reason or other, the brain and the eyes do not connect the way they're supposed to. The signal doesn't get there. And they have severe dizziness or learning issues. And so eye tracking can help, especially in this digital world. This can be a big issue. So we always preach, stay off your devices, don't scroll, don't do excessive maneuvering where you're moving quickly. And over time, between rest and rehabilitation as the next level, people do recuperate appropriately.
Wow, that's really helpful, really informative. And a lot of that in the beginning is a lot of common sense in terms of bringing your levels of activity a little bit higher each time, right? Whether with physical therapy and going and challenging your body, challenging your system to walk or slightly jog and eventually add this activity of perturbations or movement, because it's really about how much that brain can handle in terms of the movement up and down, right? And then going back to sport. But so helpful. Thank you so much. Really, really helpful information.